what is a 5-point agenda? I recently picked up this book written by Robin Ryan, where the author suggests having a 5-point agenda for every interview. That is, she suggests having 5 points which are very significant accomplishments of yours, significant experiences, your major strengths that you absolutely want to make sure you discuss with the interviewer at the interview. And the point is to have this agenda in your mind throughout the interview and find ways to deliver that to the interviewer. Let's go over an example of a 5-point agenda for an applicant and see how he or she can tackle questions. Let's consider a residency applicant who, after a lot of self-reflection, comes up with 5 points about himself. These 5 points are: one, teaching medical students and nursing students; two, research on diabetes and patient knowledge; three, leading the setup of a cultural event, the cultural festival in med school; four, liking to be outdoors, doing hiking, trekking, the marathon runs; and the fifth is a personal strength where this applicant really likes organizing the work and getting to do the work very efficiently. Let's use these 5 points and try to figure out how they can be delivered to the interviewer.
What do you like about internal medicine?
I have a lot of interest in patient education. I really feel giving the time to the patient to educate them about their disease really helps improve adherence. In fact, I was doing a research study in the last few months where I was looking at the knowledge of a patient with diabetes about his or her A1C. And we did find in my research team that people who knew their A1C target of less than 7% were found to have an association with better glycemic control. So I really believe patient education, and I really believe I really do a very good job trying to simplify things, simplify complex topics, and break it down into very simple terms for the patients.
Ask me a question.
Could you tell me about what are the changes in teaching that you anticipate in the next year?
We are going to start academic half day next year.
Well, that's very interesting to know because when I was doing teaching towards medical students and nursing students, besides making sure that they're not distracted during the teaching sessions, I also like to keep my teaching very engaging and interactive by asking questions, by using a lot of graphics, a lot of drawings, and this really, I believe, helped keep their attention to what I was really trying to teach them.
Tell me about a leadership role.
Most certainly, I was the head of the cultural committee and was in charge of arranging the cultural events for my college festival for that 1 year period. And I had a team of 8 medical students whom I would delegate tasks like setting up the stage, um, letting getting the word out about the cultural events, also coordinating with other committees like the college magazine. And what was very interesting in this role that I took, that the year I organized this cultural committee, thanks to doing more advertising on Facebook and Twitter, we were able to get the most number of medical schools represented at the cultural events that I had organized.
How can you contribute to our program?
I believe I can contribute to the program not just by providing high quality clinical care to my patients, but also trying to work very closely with my peers in improving and maintaining their well-being. I do realize and I've read a lot about how burnout can really impact resident performance. if given a chance, I would really like to organize 5K runs, outside the residency program, just to get everyone involved and be in good health.
Tell me one strength of yours and an example where it helped you.
I believe my major strength is my ability to really organize my work, set priorities, and really try to be most efficient at finishing the work with wasting very little time. And I really try to find different ways to improve my efficiency. For example, when I was doing my med school rotations in internal medicine, I had to do bone marrow aspiration as a bedside procedure, this over the sternum. And what would happen is the first few procedures that I did, I would set the procedure tray, um, start prepping the patient, and then I would have the nurse notify the pathologist to come and so that he or she could prepare the slides. But this led to about 20, 30 minutes waiting just for the pathologist to arrive there. And it was a time wasted both for me and for my patient. So what I did the next few bone marrow aspiration procedures, I would first notify the pathologist that, hey, I'm getting ready to do this bone marrow aspiration procedure. And then I would start setting up the procedure tray, prepping the patient, taking the consent. Um, and then by the time all was done, that's when the pathologist would arrive and I would take the bone marrow aspirate and give that to the pathologist. This way, no time was wasted. Just by reorganizing my workflow, I was able to save precious time. And I believe this is a strength I would really continue to use in residency and throughout my medical career.
You stated that you want to join a resident committee. Why?
I really would like to use my leadership skills to serve in committees such as the well-being committee. When I was in med school, I was the cultural organizing secretary for cultural events in my med school for a 1 year period. And that's where I really learned a lot of teamwork skills, communication skills, and developed a strong leadership role. And I do believe that I would like to continue um, working in the form of committees, especially the well-being committee, and try to uh, contribute to improve the well-being of the residents. So you can see that the 5-point agenda is very helpful because it allows you to take out every opportunity to present the most significant accomplishments, experiences, and strengths to the interviewer. Yes, you cannot answer every single question, like you cannot possibly answer, tell me about an interesting patient you saw, or some other questions in that fashion. But at least rather than missing out on important stuff about yourself, you can make sure that you're making the most of your interview time and presenting your best self to the interviewer. This is what I did. I didn't really have 5 points. I had maybe 3 points in my mind, but the concept is the same. And there's no point having more, like a 7 or 10 point agenda, because then um, the short nature of the interviews, you will not really get a chance to present all of them and will cause a lot of distress. So I do believe a 5-point agenda is manageable, it's doable, and I really think will help improve your interview performance.